Good evening, everyone. Welcome to our second of our 3 Plum Borough School District Community Connection Nights. These nights were designed to provide resources and tools for families to make more informed and meaningful decisions about how they can help our children. I'm going to share with you some statistics that we as a country must consider as we think about the well-being of our children. According to the CDC, 15.8% of youth ages 12 to 17 report suffering from at least one major depressive incident in the past year. More than half, 55%, reported they experienced emotional abuse by a parent, another adult in the home, including swearing at, insulting, or putting down of a student. 11% experienced physical abuse by a parent other than an adult in the home, including hitting, beating, kicking, or physically hurting the student. More than 29% reported a parent or another adult in their home lost a job. A quarter of our teens struggle with hunger. 2/3 say they had difficulty with their schoolwork. Suicide is reported as the second leading cause of death among people ages 10 to 34. During the COVID pandemic, more than 1/3, 37%, of high school students reported they experienced poor mental health, and 44% reported that they persistently felt sad or hopeless during the past year. Behind every one of these numbers is a child. Someone's daughter, someone's son, maybe a brother or a sister. Very few of us have been untouched by the challenges that mental health concerns can present. But together, we can end the stigma that is often associated with mental health by having evenings like this tonight and learning that we all have barriers to our success that can be overcome. I would like to thank our esteemed panel for giving us their time and their talents tonight. I'd also like to thank my team, led by Denise Sedlak and A.B. Iben, for their efforts on this initiative as well. And with that, I thank you for coming, and I will turn it over to Ms. Iben for some further words. Thank you.
Good evening, everybody. Thank you so much for coming. This is my first evening event out here, kind of speaking in front of the podium, so it's nice to see so many faces, and I am grateful that you are here. I would like to take a minute first to thank our panelists for coming and their willingness to stand up here and share some information with all of you. This isn't always the easiest thing to do, and I'm sure that some might have a few nerves, so we'll take a deep breath. I'm going to start with Jim Phillips. So Jim works with us here at Plum. He's the manager of the Student Assistance Program and Prevention Services for Devereaux Turtle Creek Valley Community Services. Jim has a Master's of Education in School Counseling. He has 19 years of experience in the field. TCV is the SAP provider for 10 school districts in Allegheny County, along with being in some charter schools. For the past 2 years, they have also provided summer programming to students in the Plum School District through their summer camp for grades 2 through 6 and counselor and training program, grades 9 through 12. Jim also has experience in the service coordination, mobile therapy, and working with alternative education settings. So give Jim a round of applause for coming. Thank you very much. The next panelist I'd like to introduce is Heidi Sasson. Thank you, Heidi. Heidi is a school-based liaison from Allegheny County Department of Human Services Office of Behavioral Health for the past 11 years. Heidi serves as a link between educational systems, mental health providers, and social services agencies. She's also one of Allegheny County Student Assistance Program coordinators. Heidi has been working in the behavioral health system since 2005 with experiences that include group homes, residential treatment facilities, partial hospitalization programs, and service coordination. So thank you, Heidi, for coming. Next, we have Heather Stone. Heather's a clinical director at Kaiser Health and Human Services. Heather has a master's degree in clinical psychology and a behavior specialist license. Heather currently oversees IBHS services at Kaiser and supervises BC, MT, and BHT staff. Heather was a BC MT for Kaiser from 1997 to 2000 and has been the clinical director since 2000. Heather has been a senior level certified crisis trainer for Kaiser since 1999. Kaiser provides intensive behavioral health services, individual services, written orders by a licensed evaluator, and outpatient mental health services for children, adolescents, and adults. So thank you, Heather. Next, we have Ashley Diolis. Welcome, Ashley. Ashley is a child and adolescent supervisor at Life Project, HSAO, which provides intensive service coordination for children who require a high level of mental health service. HSAO provides various levels of service coordination with the main goal of linking children and families to mental health services. Ashley started as a service coordinator in the Life Project in 2013 and began supervising in 2016. So thank you for coming, Ashley. And last but not least, Ryan Kesterholt.
In the house.
All right, you're quite popular, Ryan. He's the manager of wellness and sports performance at Plum School District. He's been the district's athletic trainer and involved in fitness and wellness for 17 years. He provides fitness counseling, strength and conditioning programming and implementation, and basic nutrition suggestions. So thank you, Ryan, for coming. And we have one more. Our moderator tonight, Paula McCommons. We are very lucky to have you here this evening. Dr. Paula McCommons serves as a behavioral health liaison for the Allegheny County Student Assistance Program. She also serves as a program manager for the SAP as staffing warrants. Currently, Dr. McCommons provides SAP services to K-12 students in 2 school districts covering elementary K-8 and high school buildings. Her supervisory role includes 2 suburban school districts. She and her fellow liaison are responsible for screening individual at-risk youth, offering ongoing support for referred students, assisting families in accessing appropriate resources in and out of school, participating in core team meetings, and providing consultations to faculty and parents. As needed, they also provide postvention services. As Director of Star Center Outreach Activities, Dr. McCommons provides crisis intervention, postvention assistance and consultation to school districts and communities across the Commonwealth of Pennsylvania following a tragic loss. Upon request, she conducts specialized trainings and presentations related to the promotion of behavioral health, suicide prevention, intervention, and postvention. Just a few more things, I promise. Dr. McCommons has assisted her Star Center colleagues in providing technical support for the SAMHSA-sponsored Garrett Lee Smith Suicide Prevention Grants for Pennsylvania, originally focusing on screening and primary care, transitioning to suicide prevention in schools, and now focusing on strengthening the continuity of care for youth identified at risk for suicide. If you could please give a very warm welcome to Dr. McCommons as our moderator this evening.
Back out to all of you.
Okay. Would you like me to hand you the microphone? All right. Maybe.
If not, I can speak.
Nope, I got it.
Okay. All right.
Okay.
Thank you all so much for the warm welcome. On behalf of my behavioral health colleagues, we really appreciate this opportunity to give you a firsthand overview of all the different types of services that can be helpful in terms of promoting mental health, but the broader umbrella is actually behavioral health. So I realize we have a lot of students in the audience, but we also have quite a few parents and caregivers out there as well. If you look at the back of insurance cards, it doesn't say mental health, it actually says behavioral health. So just a quick aside, when we talk about mental health and mental well-being, we're talking about emotional, mental, cognitive, our thoughts, our feelings, our emotions, and how we're managing those, how well or how poorly. But when we talk about behavioral health, we're also broadening it to also talk about our actions. How are we coping? What are the behaviors involved with that? So I think sometimes we use MH a lot, mental health, and we have to take that step back to look at the broader, the broader umbrella, if you will. We've all survived a global pandemic, each and every one of us in this room, which is no small feat. But it certainly was not without strain and drain, regardless of your age, regardless of your role within your family, your school, or your community. And I think we can't underscore how that prior to the pandemic, so many students would say, before the pandemic, I was like this, and now I'm like this. And to recognize that it's not just for students, but it's also for the adults in their lives as well. So even though we're going to focus this evening on what are some of the things to look for, what are some things we can do, what are some types of services that can be available in terms of a continuum, we also need to make sure that as adults and caregivers that we look in the mirror and that we make sure that we're modeling to the young people in our lives that we don't have to be perfect, but to be aware, to be able to access resources and services for ourselves as well as for our students. I like to tell my students, nothing against Plum, but one of my districts is Alderdice in the city, is that you need a posse of support. So whoever you live with, that's great, but then expanding, especially as you become a young adult, who else can you go to and what other resources can there be there? And as you be that confident for that friend in your life, to recognize when it's time to be a confidant and when it's time to get consultation in terms of getting support and resources for your friends. So as we sort of begin to sort of address some general resources that are available, I have to give a shout out to my hometown. I grew up in Latrobe, literally in Mr. Rogers' neighborhood, and he got me through 8th grade, I swear, being able to come home every day and have that soothing voice and tell me that I was special and all that kind of good stuff, especially transitioning into high school, even way back before COVID ever hit. But being able to recognize that we can manage things. And so here's to paraphrase his quote. Anything that can happen to us as a human being can be talked about. Anything that can be talked about can be managed. And if we do so with love and understanding, we're all the better for it. Give it up to Mr. Rogers. Woohoo, woohoo. Some of you are going to Google who Mr. Rogers is. I'm fully aware of that, but others of us know who Mr. Rogers is in his neighborhood. Okay, so at this time, I'd like to take a moment and to have each of our panelists talk about a little bit about their agency, a little bit what types of services they offer, and then how they might interface or how they might work with students of school age. So Heidi, is that okay? First? Yeah, thanks.
Hi, good evening. I'm Heidi Sasson. I am a school-based liaison out of Allegheny County's Office of Behavioral Health. We are the administrators of many behavioral health programs, and we monitor many of the treatments that are in Allegheny County. One of our jobs is to be the SAP administrator, so we monitor and make sure you're getting a quality SAP service from Turtle Creek Valley. We also are here to help you build behavioral health resources within school districts. So Plum has family behavioral resources. We are there to help build that service, make sure that everything is going really well in Plum School District for that service line, and to triage any situation that may come up. We also are here to take calls from school administrators, principals, school counselors, social workers, that when kids and families are hitting roadblocks in our behavioral health system, that we help them get over that, because we want to make sure that families and kids get everything that they need in order to be successful.
Hi, everyone. My name is Jim Phillips, manage the SAP and prevention program at TCV Devereaux. What we do here in Plum Borough School District, we work in all of your schools. I have liaisons in all of your buildings. You know, anybody can refer, you guys that are students here, you can refer yourselves to student assistants. You can refer your friends. You guys all know people that are struggling, you know, friends that are struggling. So it's not just the teachers, the staff in the buildings that you can refer students to student assistance program, but you guys can do that as well. Since the students are here, I want you to know that, and please do that when you know of somebody that's in need inside your classrooms. Part of what we do in the student assistance program is once we have parent permission, which we need signed parent permission in order to meet with a student, being that we're an outside agency. But we meet with the student, we screen them, we want to see how you're doing in school, what kind of barriers you're facing here at school, as well as some of the issues you're having at home. So we want to get to know both sides of that so that we can make appropriate recommendations for behavioral health, whether it's mental health and or drug and alcohol. We will also talk to your parents and guardians after we meet with you as students. And once we talk to the parents, we want to help not only the student, but your family gain those resources that you need to be successful, as well as to help the students be successful in what they're doing. So that's what we're doing here in the district. Also, the past 2 summers, we ran really great summer camps here in Plum Borough School District. A lot of the kids that we also had counselors in training here from the high school. So we had 2 great years of that. That's an opportunity for structure and different things in the summer that doesn't exist once the school year's over sometime. So we've enjoyed doing that as well. But I'm happy to be here and answer any questions you guys have. Thank you.
Hi, everyone. My name is Heather Stone. I'm the clinical director at NYSAR Health and Human Services. And as mentioned, we provide intensive behavioral health services under the individual service umbrella. So what you might have known previously as wraparound services is what IBHS individual services are now. So kind of how we work with school districts, especially Plum, we can receive referrals from anyone, really. We receive referrals from the SAP team, guidance counselors, caregivers, parents, even children 14 or older can refer themselves. We've had that happen before. So we certainly welcome that because we certainly want an investment in the service. So it's nice when teenagers can realize that they need supports as well. So when we receive a referral, we'll do a phone intake. Then we will set them up with what we call a written order, which is basically like an abbreviated evaluation that you can get through like a licensed clinician or have a full psychological evaluation with a psychologist. And then if IBHS individual service is recommended, then we assign a therapist. So it could be a behavior consultant, it could be a mobile therapist. As a master's level clinician, there could be behavioral health technician involved, which used to be TSS staff that kind of works one-on-one behavioral supports with children. Then we assign the staff, and then we do an assessment period. So one of the things that we're required to do is we're required to assess children's mental health needs in the home, community, and school setting. So our staff will do that and then work with the families and caregivers, teachers, whomever, to develop treatment goals and a treatment plan. So children receive, like, the authorizations are about a year long. They can be shorter if necessary. And then the idea around it is to meet the emotional needs or the behavioral needs of children, adolescents. We actually work with children as young as 2 all the way up to 20. So services are very individualized based on need. We work with children that have ADHD, autism, mood disorders, the whole kind of gamut. But like I said, the goal is to really work as a team. We work with all the team members that are involved with families, with releases, of course. So we could work with PCPs, psychiatrists, CYF, foster care, SAP teams, school personnel, mentors, coaches, religious leaders, whomever the family gives us permission to work with. So that's kind of our service in a nutshell.
Hi, everyone. I'm Ashley Diolis. I supervise a service coordination unit at HSAO. Our primary goal is to connect families to mental health services. So whether you're hitting a barrier accessing services, sitting on a wait list, you're underinsured, or your current insurance doesn't cover the full service, we're the people that kind of step in, help you make those phone calls, and link to appropriate services. We do all of our work in the community. So if a referral comes into us, we're coming out to your home, to the community, and meeting you where you're at. How we work with schools is school counselors can refer to us, teachers can refer to us. You can also self-refer, so we get a lot of parents that just call us and need some help. We do offer various levels of service coordination at HSAO, so whether you're on the higher end of needs or lower end, there's definitely a program that can help you.
Hi, I'm Ryan Kesterholt, and I'm the manager of the Wellness and Sports Performance Program here in Plum Borough. I work with students via fitness programs and strength and conditioning programs with the sports teams. I also provide basic nutrition advice for any student that is looking to utilize nutrition for performance in school or performance in sports. If you look into nutrition, it can help with wellness, overall mental wellness or physical wellness. It's not just physical wellness. So the biggest aspect that I try to work with students with is working on their foods and what they're eating and trying to get them to eat better and realize that that does affect their mood and can affect everything aspect of their life as well. So.
So it sounds like you all can attest to Ryan's expertise and his support of students in their overall well-being. I can certainly attest for my other fellow panelists here. I have personally worked with each and every one of them for more than 10 to 15 years at least, and I can definitely give a shout out to their commitment, their willingness to collaborate, and their compassion to work with students and families to get whatever services are needed. So moving into the next portion of our presentation this evening, we have some questions that came in. Feel free, if anybody else wants to jump in, feel free to do that. We kind of touched on some of them initially, but perhaps, Heidi, do you mind just giving us a little overview of what the continuum of what different levels of care are? I have to tell you all, as I'm sitting up here and I'm thinking about you all in the audience, I'm like, oh, a treatment plan, authorization, written order. It's like you almost need a little cheat sheet or glossary maybe of what some of those terms are. So I'm going to ask my colleagues here to maybe decode what some of that might mean, recognizing that for some folks, they've been in services ever since they were in third grade, or since they were 3, not to mention third grade. And other folks don't get involved into the behavioral health system maybe until they're in high school. So oftentimes it's a need to know. So if you don't need it until you're older, you may not have a little catch up to do. Others of you may be very well familiar, or you may have a sibling or somebody else in your family that has gone through the behavioral health system. So yeah, sure. Thanks.
Hi. So fortunately in Allegheny County, we are very resource rich. We have a very large continuum of care for child and adolescents here in Allegheny County that range from outpatient, some outpatient, you might go to a facility in the community, or you have school-based outpatient where you can see a therapist here at school. We have numerous community supports like IBHS, what Heather was talking about, meeting a therapist or a behavior specialist in a community setting. We have family-based services where 2 clinicians will come to your home. They'll meet you at the school. They'll meet you at the library, wherever the family is most comfortable, and give you the service that you need. We also have things that are outside of the school that you might attend during the school day, like a partial hospitalization program, where you would go, you would get education there, you would do individual therapy, you would do family therapy, and gradually come back to Plum School District or whatever your home school district is after you completed your service. And we have numerous things up into inpatient services, where obviously some children and families, or some children might need a hospitalization, and we have hospitals to go kind of get you back on your feet and return back into your school and community. So we are very fortunate here in Allegheny County. We have a lot of service providers that provide many of these services, and honestly, the best way I would tell students to access them is make a referral to your student assistance program. Refer yourself, refer your friend if they think they need one of these services. We have service coordinators that can help link kids, but the student assistance program will do a screening. They will say, hey, I think you might be appropriate for this. Let's go get an evaluation for this level of care. And it's an easy way to access services for families.
Excellent. Thank you. And what does IBHS stand for?
Intensive Behavioral Health Services.
Again, those are one of those things where we throw out these acronyms or these letters like alphabet soup, right? And so one thing I might just interject, that when we're talking about different levels of care, it has to do with your impairment or your functionality. So are you able to come to school? Are you doing well academically or personally? And if not, what's the least restrictive services that we can offer you, knowing that there is those other levels that you can come back in and out for. So to that end, maybe Ashley, do you mind talking about how someone can obtain an evaluation and what that means?
Yes, so the easiest way to do that is to call that number on the back of your insurance card to see what's in network and what's covered. But where service coordination comes in with that is if you are hitting barriers, we can help you make those phone calls. So if you're calling a bunch of providers and there's a lot of wait lists, we would step in, help you with those phone calls, reach out to providers and see if we could really push to make it happen quicker. Do you want to?
Yeah, I can even speak to that. One of the other things too, if families are covered by Medicaid, they can even access through community care behavioral health website. There is a link for families, and you can input kind of what you're looking for, and a whole list of providers under that given service will come up. So it'll give you their name, address, contact information, how far they are from you. One of the other things too is, I know you mentioned a written order. That's a little bit of a mystery to some people. That's a completely new, I guess if you want to say, avenue to explore with accessing services. So it's basically like a prescription that you would get if you went to a physician. So it's like an abbreviated appointment. You go in and you meet with a licensed clinician. So it could be a licensed social worker, an outpatient therapist, whomever. It could be your PCP, pediatrician, a nurse practitioner. You express that you're having some emotional or behavioral concerns for your child, and then they have this thing called a written order. So it takes a little bit of background information, maybe establish a few goals and recommendations, and then it might warrant a prescription for IBHS services. So it's kind of like a quicker and easier way to get a prescription for IBHS, because it's a medically necessary service, so you definitely need that prescription. Or you can go the full evaluation route. So you can contact a psychologist or a psychiatrist. They can do a more thorough, in-depth evaluation. And if the outcome is a prescription for IBHS services, then that's another way to do that as well.
Heather, can you talk? Yeah. Can you talk about what a diagnosis means, to have a mental health diagnosis?
In what respect?
In terms of what the evaluation leads to what?
Okay, so in order to, I guess, qualify for IBHS services, it would require a mental health diagnosis. So it could be an ADHD diagnosis, it could be an autism diagnosis, depression, anxiety, kind of the whole gamut. The evaluator or the person doing the written order will kind of they'll use certain assessment tools to kind of assess the need for services, and then kind of looking at your symptomology to develop a diagnosis. And then once you have that written order that has the diagnosis and the prescription, then you can bring that to an agency, and then they can kind of tailor the assessment and a treatment plan around your diagnosis, your symptoms, your needs.
So one of the things just to think about as a quick aside is that, especially since we have an audience of a bunch of young people in front of us, that as you get older, you will recognize more and more that as adults, we often talk out both sides of our mouth. So earlier when I started, I said to you, hey, behavioral health is the broader umbrella, and mental health is sort of specifically looking at emotions and thoughts. And yet, up here, we've been talking a lot about the mental health diagnosis. So again, our language overlaps, and that's why we have things like service coordination or all these other levels of support to help navigate. And as Heather had shared, just recently, there was new state regulations that then said what types of services you could offer, what the criteria was, what kind of diagnosis you had to have. It's a lot, even for folks who've been in the field, who are educated in it, let alone students and families who are just trying to navigate this to begin with. I want to ask a real quick interactive question. How many of you, the last time you went to your primary care doctor or your pediatrician, were given either an iPad or a sheet where you had to answer behavioral health questions? Yeah, I don't know if the camera can see, but almost the entire audience of our young people. That's because about 10 years ago, the National Academy of Pediatrics said, hey, guess what? When you go to your pediatrician or your PCP, we shouldn't just be checking your height and weight. We should also be asking you about how's your sleep, how's your mood, how are you getting along at school, to look at you as that comprehensive whole young person to be able to catch things sooner than before they become so impairing that you're not able to come to school or not able to get along or do well academically or personally. So whenever Heather mentions about an evaluation leading to a diagnosis, it's actually a medical diagnosis. So there's actually criteria that says things are going on. Again, I think we take for granted I think what we're sometimes sharing with folks. So thank you for that aside. Ashley, do you mind talking about what happens if somebody doesn't have insurance?
Yes, so if typically this is what the Life Project works with. If a family comes in with no insurance, a lot of people don't know this. Through medical assistance, there's a loophole, and it's the mental health loophole. So if you have a diagnosis through an evaluation, you will qualify for that insurance no matter what. And the reason why kids qualify for that insurance is because they're entitled certain services to help them work on those goals, get a treatment plan, to help them be successful. So that's one of the biggest referrals we get is for families who do not have insurance or they're underinsured. So like the service Heather talked about, IBHS, and the other services that come into your home are typically not covered by your private insurance. So we help families access that insurance so they can get that service.
Can you talk about a treatment plan?
Heather, good.
What a treatment plan is?
Sure.
Just in a nutshell.
Yeah.
Okay. So one of the things that Paul was asking was about a treatment plan. So what we call them under IBHS is, or ITPs, or intensive individualized treatment plans. So basically what that is, the treatment plan is based off of the outcomes of the assessment. So what comes out of the assessment are recommendations for goals. So what we do is we work with families to, start with creating the background information. We develop their community and natural supports are noted in there. We look at developing short-term and long-term goals. And they all should be measurable. So we know, whether you're making progress, whether things are regressing. And then basically once we know where a family starts, so we kind of initially start with parent report or school report to kind of create a baseline or a starting point of where the child is with any given goal. And then we also look at what would be a good measurable discharge criteria based on that measurable aspect. So if we want to, say, have a goal around reducing anxiety, and the family initially starting services rates a kiddo a 2 out of 10, which would be, they're really impaired by their level of anxiety, then we're going to incrementally work on increasing that rating towards, a 10 as best we can. But the family might decide, or the child might decide that, I think we could discharge if it was at an 8. An 8 would be manageable. So we kind of work with families to also choose goals that are reasonable as well. So we can work towards discharge that meets the family's needs and expectations as well. Then we look at expected outcomes, like what do we want what do we want services to look like when it's done. We do aftercare planning. We do we will fade out services sometimes. So a child could have as many as an average of 4 hours a week of therapy, which is pretty intensive, but that's kind of the nature of the service. It can be that intensive. And then we can kind of reduce services over time as a child makes progress. We might reduce it down to 3 hours a week, 2 hours a week, and then establish like a discharge date. So, and that's all kind of wrapped into the treatment planning.
And so either Heidi or Jim, do you mind talking a little bit about some drug and alcohol specific services?
Want to go first?
All right, so with drug and alcohol, a lot of times, and what I want to say first is what we see now with drug and alcohol is co-occurring. And what co-occurring means is you have drug and alcohol issues and mental health issues. And a lot of the treatment that's out there now for drug and alcohol, you have to have that mental health component in it because there's a lot of that that exists. Why do you use, drugs and alcohol? Sometimes you can be using that for some reason. You got something going on in your life that's causing you to use. So I want to say that first and foremost about drug and alcohol, but there are services in Allegheny County that we can tap into. What my agency does in a couple of our school districts is we have drug and alcohol policy violation programs in school districts. And what that does is it identifies kids, they go through a screening, they get into groups in the school, and that can somehow, because anytime, hopefully you guys know if you get in trouble in school and you get suspended because you have a drug and alcohol policy violation, some districts are different in but most will suspend you. But this program that exists, diversion program that we do, in some districts exists to help those kids in school while they're there, and sometimes that can limit their suspension as well. But some of the services that are in Allegheny County, downtown Pittsburgh has a place called Pathways to Recovery. It's a 24/7 walk-in. It's kind of like the drug and alcohol version of Resolve Crisis. For those of you that know Resolve, and I might as well talk about that while I bring it up. But Resolve is a crisis network in Allegheny County. As long as you live in Allegheny County, you can access it. You kids that are sitting here, the students, you guys can call, your parents can call. That's a 24/7 service as well. They will talk to you over the phone. They will come out to your house if necessary, or out in the community, wherever you are. So, for those people that are struggling and need somebody to talk to, that's what Resolve's there for. And on the drug and alcohol end, that's what Pathways to Recovery. They will get you to that inpatient drug and alcohol place that you might need. Drug and alcohol also has outpatient. So a lot of those things that mental health has on that end, drug and alcohol has that as well. But again, there's a plethora of resources here in Allegheny County to access for drug and alcohol at different levels of care as well. So I don't know if you want to add anything to that.
I have two things I would like to add. Another is you can call PA Get Help Now, and they will also help you find the level of care that is appropriate for you and get you an assessment. Another shout out I want to make is HSAO and Three Rivers Youth, it's new this year, have drug and alcohol case management. So just like in the mental health world, we have service coordination, we now have service coordination for drug and alcohol needs. So if you or someone in your family needs help in accessing outpatient for drug and alcohol, and there's insurance issues, and you're just not sure where to go, HSAO or Three Rivers Youth now has DNA case management that can most definitely help families access what they need.
And I know we'll be talking about the resource fair whenever we're closing this portion of our presentation, but Resolve is actually out in the lobby and has different cards. But those of you that have a cell phone, if you want to pull it out right now, we'll do a brief intermission, and you can enter the new National Crisis and Suicide Prevention line 988. How many of you have heard of that already? It came out in July. Some of you, excellent. Okay, now you're in the know, so please tell at least 3 people between now and tomorrow what the new National Suicide and Crisis Lifeline is. It's 988. You can either call or chat, or you can text, and it's 24/7. All right. So one other question before we move into some other general parent questions. Any of you can address this one. If a student is receiving mental health services, will the school find out? And how can they find out? Like, what's the way to do it?
Well, it's kind of a layered answer, I suppose. I know for our services, we require releases of information from both parties. So,
Can you explain what that is?
right. So it's like a dual release. So we have the family sign a release that we can either release information, obtain information, or just coordinate by like phone, email, whatever avenue, faxing, whatever. And then the family also would need to sign a release with the other party. So it would be the school or whomever else we're trying to coordinate with. I know for us, we have some families that don't want us to have any contact with the school, and we need to respect that. In other situations, they might allow us to coordinate only, but not release information or obtain information. Or you can send my child's treatment goals, but not their assessment or their, so it really is very individualized.
Can you speak about age 14?
Ah, yes.
Since we have students in the audience.
Right. Yes. So teenagers 14 and older also must sign the release form if they're consenting to have to have our agency or any of these agencies, I suppose, coordinate or release information or obtain information. So without that, we can't do that.
Sorry. And that's actually Act 147 that says if you're 14 or older, you can seek behavioral health services and or medication. Now, ideally, you're part of a family, so we would want to be able to share information, but at the same time, it's important to know kind of what your rights are. And the other is weighing the pros and cons of, with school-based therapy, it's still a private agency in the school building, so you still have to have those releases of information, but at the same time, because it's in the school setting, thinking about, okay, how can that be helpful if certain teachers or certain student services folks know information that can help me to achieve my goals in terms of what I'm trying to work on in terms of managing behavior, emotions, and thoughts. Okay. Next segue. Ryan, it's been a little quiet down there, so here's one definitely coming your way. A couple folks had asked, how can I support my child or my teen's mental health wellness at home?
If for support at home, I believe setting the example, being the example that you want your child to be is a big part. Children learn by example, so you doing healthy things, you being able to admit that maybe you have any mental health issue, if they see you doing that, they are going to be more likely to be able to go and talk to people as well and get in contact with these agencies if they see parents doing that as well and when they recognize those things. The other support things that you can do is setting them up on some sort of a fitness routine. Fitness can help with hormone release and help the feel-good hormones come out in the kids, and then they will begin to feel better about themselves or feel better about whatever's going on. As I spoke earlier, nutritional stuff as well is a large part. Nutrition takes a large part. If the kids don't have the right building blocks, then they're not going to be able to build a healthy body or even a healthy mind. So providing them with the correct nutritional stuff can help greatly with everything as well.
Yeah, please do. Anybody that would like to chip in, absolutely.
I just want to add to that. One of the main things you could do to support your kids at home and your students, and for you guys that are students here, you can support your siblings on this, is have that time to support them and talk to them every day. Spend time with them one-on-one, or shooting basketball, whatever it might be that you're interested in. It's spending that time every day to let each and every one of the people in your family know that they're important and they're wanted. A lot of times people don't have that support and you don't realize that. So just spending that time, whether you're a parent with your kids, setting up routines, is that having dinner together, or is it having a snack at night? Anything that you can do, take your kid to a concert, take your kid to a football game, spend that time with them daily. I mean, tremendously, we're talking about all this treatment stuff, but it all starts at home, right? So it's just spending time and talking. And I don't care how old you are, whether you're a senior, you're in kindergarten, we all need that support. We need it as adults. So just be there for each other and spend that extra 10 minutes that you might not have done yesterday. I think that above anything else we say up here today, that to me is the most important thing.
Hear to that, Jim. And to be honest with you, we are talking a lot about the treatment end, meaning that behaviors in my life or how I'm coping isn't so healthy or so well. And so what are we doing to get other folks to help me with that or help my family with that? But when we talk about resiliency, just like you're born with muscle, you can strengthen your muscle. You are born with the natural ability to cope, survive, to persevere, even in a pandemic. And one of the things that we have found that the isolation that, again, not only students felt, but certainly the adults in their lives too, one of the most powerful anecdotes to that is connection. So whoever we can have that connection with, again, whether or not it's peer-to-peer, or Jim said even like with your siblings and or with caregivers, and if it's someone you live with or that you're related to, that's great, but I can guarantee you that even some of your coaches that you guys would go to the mat for, or obviously Mr. Ryan up here, or other teachers, that it doesn't have to be someone that you're related to, and that's the power of connection. And if we can do it with compassion and awareness, again, we're all the better for it. All right, couple other questions before we go on to the next part of our program for this evening. So several parents have asked, what does it look like? How do I know what's normal behavior, typical or not typical? So my teen wants to be in their room more by themselves. My teen won't let me look at their phone. My kid is moping around the house a lot or tells me that everything is boring. Is this normal or not? Anybody would like to? Yeah, thanks.
Here's what I'll start with that. We all know our kids. As soon as you notice something different, and the younger you notice it, jump on that opportunity to get help in place. So if you don't see it as normal in your house, then pay close attention to that. And that's kind of a follow-up from what I just talked about. I mean, if you talk every day, hopefully they'll tell you what's going on. And if they don't, hopefully they'll tell somebody else, like a coach or somebody at school that they trust. But, as parents, as brothers and sisters, grandparents, we know our kids. I mean, I have 4 kids myself that range from 12 to 5. My oldest is 12 and he's in 7th grade and he's in middle school. Does he tell me everything anymore? No. But, he does know. I ask him about his day. So what happened today? And he will tell me, even in 7th grade. I hope that continues through high school and college and when he's an adult. But I think by me showing interest every day, you pick up on those things. If they are, get them involved in sports if they're not. It doesn't have to be sports. I mean, music, art. What are their strengths? Each of us in here have different strengths. So I think getting them involved in social activities, it could be through churches, through, youth groups, whatever works for that kid. Everybody has a strength. So finding out what that strength is, that's part of what we do in our screenings through the Student Assistance Program, is not only finding out what the need is, but what is that strength that we all have. But some kids will sometimes think we don't have those strengths, but guess what? You do. It's either you didn't tap into it yet or you didn't find it. And we're here to help you find that. Your coaches are, your parents are. So I don't know if this is answering her question, but I think keeping our eyes open, keeping our ears open all the time, that's going to help us know the kids. But as soon as you see something different, look for help, look for it right away. The earlier the better. Let's not wait till high school. Let's catch this in elementary, because I'm here to tell you that stuff does start then. And if you do, catch it then these services don't have to be around for your whole life. I mean, that's why they're here, so we can get them now, get the help that you need, get those natural supports in your life on board with that, so that you have them to turn to. And I'll let anybody else.
Yeah, anybody else want to? Yeah, Brian? Yeah, please.
I think if it doesn't seem natural to you, or if it seems out of the sorts of their normal for you, and maybe they are starting to withdraw from talking to you as a parent, maybe go to their friends and talk to their friends, because sometimes maybe they're communicating with their friends, or maybe they are communicating with a coach or someone like me that they see often, because they don't feel comfortable going to their parent. Maybe communicating with them, if you feel something is off, that can always be a resource for you as a parent that can help you gain sight what's going on in your child's life as well.
I can add something. I know a lot of the pediatrician offices have now built in a behavioral health component, so you can always reach out to your pediatrician and have them screened there. And they'll do the assessments on the iPad, and you'll be able to talk with a therapist, and they'll be able to make a plan.
Thank you, Ashley. You read the bubble above my head. Oftentimes, the first place to go is to your pediatrician to kind of say, again, they're now assessing this and tracking that to see kind of what's quote unquote normal or not. I would say for the parents that ask those questions, if you're having that question or thinking about it, you've already answered it. That chances are you need to not necessarily look into treatment, but to at least take that next step, which may be with the PCP or the school counselor or the school nurse. Allegheny Family Network, to put a shout out to them, is an incredible statewide, also here in Allegheny County, that's parent to parent, that talks about any kind of behavioral health support for having a child or a teen, and different types of resources. There's no one way, and I think sometimes before the pandemic, we had to really sell folks on the idea of getting help. Post-pandemic, it's almost like, my gosh, I know my kid needs help, or I want help, or my friend got help, how come I can't get help? And when Ashley had alluded to wait list or, having to, just not get the services you need, then it's sort of like, what else can we do? And sometimes support groups, so NAMI, the National Alliance for Mental Illness, is another across the lifespan resource, NAMI.org, that can be very helpful as an individual or as having a loved one or a roommate or a teammate that has any kind of mental health or behavioral health, challenges. We're not our disorder. And I think sometimes we need the diagnosis to be able to have the insurance to pay for the services we need, but that is not who we are. It should in no way define us. And the fact that we're looking out at young people in terms of high school students, we've been talking about Student Assistance Program, SAP, which is K through 12 in Pennsylvania. It's mandated in any public school. You all going off to college and university, your tuition is going to be paying for your student services or your student affairs, which will then also have the counseling staff, that have a psychiatrist on hand, that you'll be, again, across the lifespan. You get into employee assistance programs or have your own, family doctor moving forward. So again, this whole idea of normalizing our behavioral health, our emotional wellness, and being able to access care. One other question, and then we'll wrap up to be able to go to the next portion of our program. Several parents reached out to say, what do I do when my teen is coming to me with concerns about a friend saying, oh, they might be cutting or they're drinking excessively or they're skipping school, but my kid doesn't want me to call the other parent. What should I do? Or give me some suggestions. Always good to pause and reflect. When in doubt, pause and reflect. That's always a good strategy, okay? So I'll tell you what I tell my students when they say, but I don't want my mom to tell so-and-so. And that is, if you were the parent of your friend, knowing what you know that is causing you such concern that you went and told your parent or your caregiver, what would you do? And again, you got to remember, I'm the lady that works in suicide prevention. And so my standard motto is, would you rather have your friend be pissed off at you or have your friend not be here? And usually that's sobering enough for you to know. And again, if you're in a healthy space as a young person, you know what to keep in confidence, and you know when you need to consult, when you know, hey, this is above my pay grade. And I think to really trust that, and to trust, even if it's not a friend, but it's an associate, it's a classmate, it's somebody that you're seeing, on TikTok, Instagram, whatever cyberspace is, but being able to say, look, if I'm aware of something, what can I do to play that forward? Not that you're responsible for it, but you do have an opportunity. Yeah. Safe to say, thank you so much. That's right. Safe to say, we have the 988, the resolve, absolutely. Absolutely. Okay. Yes, Heather.
I think it's a really hard position for teenagers to be in. It's basically having loyalty to a friend's secret, and that can be very scary, and that can be very challenging. But I think looking at it in such a way that your loyalty to your friend is about their safety and their well-being, because we don't know what. Cutting could mean so many things. It could mean something very superficial. It could mean something that requires medical care to the point of it puts their life at risk. So kind of, as Paula was saying, your loyalty to your friend's safety should supersede loyalty to the secret. And safe to say, yeah, absolutely. I love that safe to say is an option, because then that doesn't, I know some kids really worry about their friendships being at risk over reporting, and that can be done anonymously. My own daughter has done that with peers. It's such a great avenue, and then they get to speak with professionals about it. They'll get pulled in and talk about the concern, and like I said, it's just one way to look at it anonymously. But I think it's a great conversation for parents to even have with their kids before something like this even happens. That you can come to me with any concerns or problems that you're having with your friends, or even having close relationships with your friends' parents is much more kind of helpful, because then you might know how that parent would react or how they'll deal with the situation, and you can better, support your child in that decision.
And certainly, as Jim had mentioned earlier, that anyone can make a referral to the Student Assistance Program. So you can, if you know yourself, gee, I'm not myself, I think I need some support, you can make a referral. Or again, if you know your friend's having not only a bad weekend, but a bad life, you can make a referral. So it doesn't mean that something has to be immediate per se, unless it is a safety issue, but certainly to kind of tease out what is it that's getting in my barrier as a parent that I might think, oh, my kid won't talk to me now if I tell them, talk to somebody else about it, or talk to that parent. If there's a legit reason that maybe there's a safety issue in talking to that other parent, then okay, then let's take a step back and think who else we can talk to in terms of trying to make sure that there's a communication happening and folks know what their resources are. This is tough. I mean, this is, literally can be life and death, and it is part of growing up. But as Jim alluded to earlier, it is all about communication as well. So please join me in giving a big round of applause to our panelists for sharing. Thank you. And we want to give you all, I have to be honest with you, we were so intimidated when we're like, oh my God, look at all these students here. Oh my God, we thought this was supposed to be about parents, not about students. So we were kind of freaking out. So we really appreciate you all being so attentive and participating. So thank you all. Speaks volumes to you all in terms of Plum School District. And now, as we make a segue into the resource fair, I want to leave you with a quote, and it's an anonymous quote, but it was actually done, it was a needlepoint from a student that I had worked with decades ago, and she had depression, she'd gotten services in high school, she was off at college, and she sent it to me, and it goes like this: life isn't the way it's supposed to be, life is the way it is. It's how we cope that makes the difference. So kudos to all of you for coming here and doing the best that you can to cope through this evening, but hopefully you also take a moment as you leave to visit the resources that are available. Thank you all so much.
I would like to echo Dr. McCommon's. To our student athletes, you are the role models. You are the heroes for our youngsters that are in our kindergarten through our middle school. And so you are in tune with what is happening in the building, and your actions carry a lot of weight with our youngsters because you are their heroes. Thank you for being here this evening. I know your coaches made you and voluntold you, but we had really hoped your parents were here because, again, this is important, so I would ask that you share the information that you gleaned from tonight to your parents. And I too want to thank our panel. Like Dr. McCommon's, I have worked with each and every one of them. It's so nice to see Dr. McCommon's here, because usually I see Dr. McCommon's with a postvention, which is after a tragedy has occurred. And so tonight is all about prevention. It's all about being the eyes and ears, and if you see something, saying something to a trusted adult. Your coaches are here, they are trusted adults, your teachers, your counselors, your social workers. We want Plum to be a tight community, and we want everyone to be valued, and we want everyone to be here tomorrow. So there's lots of great swag out there. I know you all like water bottles. There's squeezy stress balls. There's koozie cups. So